Good afternoon, Victoria County. I would just like to remind you all that KView, Kix, and Magic 95 are also live on air streaming right now. For any local information regarding COVID-19, please visit victoriatxoem.org or call our hotline at 361-580-5796. With the upcoming holiday this weekend, we will not have a press briefing from Good Friday to Easter Sunday, and the hotline will be closed as well, with normal operations resuming Monday. We will still post daily COVID counts to social media as well as any relevant or breaking information. City and county parks will also be closed through the Easter weekend as well. And as of 2:30 today, we have a total of 9 new cases of COVID-19 in Victoria County, bringing our total case count to 70. Please remember that that we're getting results throughout the day now. And so these investigations are ongoing, and some of these numbers may change before our 5 p.m. count today. Today we'll have Dr. McNeil, our local health authority, who will discuss post-acute medical becoming the COVID-19 hospital here in Victoria. And then Lane Johnson, the Chief Clinical Officer from Gulf Bend, to discuss mental health and give us some tips for coping with COVID-19. To be respectful of our speaker's time, we will have about 5 minutes of questions after the conclusion of each speaker. And if there are any further questions, we can answer those at the conclusion of the briefing. I'll now turn it over to Dr. McNeil.
Good afternoon. I have just a few things I want to go over today. I'll be brief. Let me go through the cases. We've talked about this a little bit. You know, we do have 9 new cases. These are being investigated, and we are trying to break those down into finding out exactly where those cases come from, and specifically if they're community transmission and what they're related to. And that's the epidemiology part of this puzzle. We do have 9 new cases. They are being investigated. But by 5 o'clock today, we'll have the new graphics out. I say this every day, but it's worth repeating that these numbers change throughout the day now that we have multiple labs reporting this and multiple testing sites in Victoria. So we're trying to keep track of these numbers and get them as accurate as possible. Our total cases reported so far is 70. The PAM outbreak, which is pretty much stabilized now, has a total of 31, which is 44% of our cases. Now we look at this community transmission, and we have come to the conclusion that our community transmission is now moderate. As far as the things that we said we were going to do is when moderate transmission became a problem, we've been doing those things for probably about a week or 2. So we're ahead of the curve there, and that's good. We have an early moderate rate of transmission, and that's probably about 22% of all of Victoria County's cases have been community transmitted. And remember, folks, the difference between community transmission and other forms of transmission is that when it's community transmission, we don't really have a specific source where the infection came from. So we assume that these people picked it up in the community. We have had some hospitalizations, but the majority of them are showing improvement. We have 10 patients that are 14% that have recovered, and we have specific criteria that I want to go over from the Centers for Disease Control. These are patients that are recovered or patients that have completed their isolation. They recovered from their illness, and they've had no fever for 72 hours. So in other words, 3 full days of no fever, and that's without Tylenol or Motrin or any other kind of medication that may lower their fever. And at least, and another part of this is at least 7 days have passed since the onset of their symptoms. These are CDC standards, and these are also recognized by the Texas State Health Services as well, Department of Health Services. So we actually have 52 patients that are recovering from this illness at home that we're monitoring, that we know about. We have 8 patients that are in the hospital, and 2 of those patients are on ventilators at this time. So I'd like to talk a little bit about post-acute medical, and as y'all know, yesterday we announced that actually I had released their control measures, and they're now able to move patients in and out of their facility. The patients that have been identified with COVID are now housed at their facility, and they are transferring the other patients out. They're transferring the other patients to other facilities, and those patients will be monitored closely in those facilities for any symptoms, and if need be, they can be retested. But all these patients that are moved out have, of course, been tested negative. Of these patients, I need you to understand that as far as them taking new patients out there that are going to be COVID positive, they have agreed, as we talked about yesterday, to take patients from our community that are COVID positive. So they will actually become a COVID facility, and that's going to be a great benefit to our area, because we're going to be able to place those patients in one specific area and get them out of the community. That will decrease the risk of further transmission of this disease, because first, they won't be in the community, and second, the healthcare workers that are taking care of them will also be isolated to one specific area. Everybody else, every other healthcare professional still practices universal precautions, and we're always very careful with our patients, and we make sure that we wear our protective gear. I had a conversation this morning with the Chief Medical Officer, post-acute, so that we could further delineate exactly which patients are going to go to that hospital. There have been, we get these calls on the hotline, of course, and we get texts and emails into the city. And some people have asked if they have symptoms of COVID, should they just go straight to post-acute? That's not the way it works. These are patients the patients that are going to be housed there are patients that have been into an acute care facility first. In other words, you go to your local hospital first if you need evaluation and possible hospitalization. Once these patients are stable and they can be transferred, they will be transferred to that facility. The most sickest patients, the ones that are critically ill, and these are patients that are on ventilators, and these are patients that require medications to keep their blood pressure, and they require other immediate ICU type care. Those patients will be kept in the critical care facility that they're at. So they will be in acute care hospital, which in Victoria is DTAR citizens, and those patients will be kept there until they've improved and they're stable enough to where they can go to post-acute medical. So basically, they meet the same criteria as other patients that would go to a long-term acute care hospital. We call those LTACs, and that's what PAM is. Post-acute medical is a long-term acute care hospital. So these are patients that will be hospitalized after they've been in the acute care facility. So people don't have to wonder about going to which hospital if they feel like they need evaluation in the hospital. The other questions that have come up are people always ask me how many beds do they have. Well, I called the Chief Medical Officer right before I came on today, and there's 22 beds. So they have 22 beds at that facility. And the question about treating critical patients we've discussed. They currently have 7 patients at post-acute medical that are COVID positive, and that's pretty much the information that I want to talk about as far as post-acute goes. I'm sure there'll be other questions, and I can answer those. Before I answer the questions, so I do want to say one thing, and this is the last thing I'll say before I take questions, is that we are coming up on Easter weekend, and of course, tomorrow's Good Friday, and Easter Sunday is coming up. So I want to just remind people once again that we're still not out of this virus. Things may be looking a little better in parts of the country, but this virus is still everywhere. And I want to make sure that people understand that you need to limit your activity and limit the people that are going to be in your home. I've heard people ask. I've had people call and ask, "Is it okay to have people over for Easter Sunday?" And Easter is a big holiday in my family. It's a big thing in our family too. But we're not having anyone over except our immediate family. In other words, the people that already live in our home. I would encourage everybody to do that, and I would encourage everybody not to let your guard down. We've been behind this virus since the very beginning, and we're starting to get ahead. We're starting to do better. Nationally, the numbers are looking a little bit better. We're still not decreasing in the number of positive cases, but the increases nationwide are slowing. And that's probably because of social distancing, and that's probably because of the things that we're doing, like wearing masks. So we cannot let our guard down now. And I've heard reports that there are a lot of health experts that expect a jump in cases in the next couple of weeks simply because of the Easter holiday. And we've got to avoid that. Remember that everybody knows how much they care for their family members. So just try not to be around people unless you absolutely have to, and practice social distancing and wear a mask if you absolutely have to be around anyone. Okay, I'll take some questions now.
In regards to the 9 cases, are any of those linked to PAM at this point or post-acute? And is there any demographics that you could provide on those cases?
As far as I don't have the demographics. When we get a positive case, we get a call from the lab and say, you have 27 tests out, 9 of them are positive. I made those numbers up, except the 9 is true. So that's about what we get. And then it goes to the epidemiologist, and then they start to look at that, and they make the phone calls and they investigate. So they would call your home and say, we know you're COVID positive. how do you think you got it? And if they say, well, I work at PAM, okay, well, that's fine. Or they could say, I don't know how I got it. I don't go anywhere. I don't do anything. And then we start to investigate and we go further and further into that. So those numbers are being worked on as we speak.
In both in regard to PAM, any possible link to PAM as well?
I don't know of any further ones that are linked specifically to PAM.
In regards to transferring patients, both COVID patients to the facility and out of the North facility, have any of those transfers already been made as of today?
You know, I'm not sure if they've taken any new patients today or not. I know that we had a meeting with, today there was a meeting, a phone conference with all the local hospitals explaining everything to them so that they will understand exactly what's going on as well. These patients, you know, it's going to be select patients, and we want to make sure that we utilize those resources as carefully as possible.
Dr. McNeil, I just want to clarify. So the most critical patients will stay where they are regarding the other two hospitals. Once they're able to be moved is the only time that they're going to be transported over to PAM. Am I correct in that assumption?
That's correct. And the question is about when would patients be eligible to be in a long-term acute care facility. Well, those are patients that are basically still sick. I mean, that's why they still have to be in the hospital, but they're stabilized from the acute phase of their illness. So, and we look at that very carefully, and the physicians that make those decisions know exactly what PAM is capable of taking care of. And we certainly don't want to send a patient out there that would have an extended level of care. So, but by the same token, we want to free up those acute care beds for another patient that may be sick or that really needs that ICU bed or that ICU ventilator. The system actually works quite well in that way.
With regards to the non-COVID patients that are at the PAM facility, is there a timeline or a specific time frame that they're looking at getting those patients transferred to other hospitals?
The question is the timeline of transferring the patients that are non-COVID positive. It's my understanding that that has already begun. And the idea, of course, and this is straight from CDC guidelines, is to be able to get those patients away from those other sources of infection and get them in a place where they're less likely to have cross-infection. Okay.
If there's no other questions, we'll excuse Dr. McNeil.
All right.
And Lane Johnson, the Chief Clinical Officer with the Gulf Bend Center, is going to come in and give us an update on mental health in the community. And
And-
so while that transition is going on,
Yeah, and thank you, and have a blessed Easter. I wanted to say that.
thank you, Dr. McNeil. Excuse me. So just to reiterate a couple of points, with the upcoming Easter holiday this weekend, we will not have a press briefing Good Friday through Easter Sunday, and the hotline will be closed as well, but it is open today until 5 p.m. We'll resume normal communication operations on Monday, and over the weekend, we're still going to be posting our daily COVID counts. Our daily COVID counts, as well as any other relevant information. City and county parks will also be closed through Easter weekend. And again, as of today, we have 9 new cases of COVID-19, bringing our total case count to 70. I wanted to thank Lane Johnson for being here. With COVID and Easter weekend coming up, it's going to be a different holiday weekend for all of us. So he came to give us some information to help with mental health and coping in this time. So I'll turn it over to you, Mr. Johnson.
Thank you very much, and good afternoon. Yeah, I've been asked to speak to you again this time about how do we get through a weekend that's going to be quite different than we prepared for and that we're accustomed to. And first thing I want to remind you to do is for all of us to breathe. To just stop a minute and take a deep breath. We'll get through this, and we'll learn some things from it. But then also, I want to make sure you understand that while there's a lot of things happening that we cannot control, we can't control this pandemic, we can't control that the parks are closed and we can't go into them, we can't control that we can't have our Easter picnic with family and friends. But what we can control is our attitude about it. We are always in control of that attitude. And our attitude is what determines how we perceive things. And how we perceive things is how we perceive things. That's our reality. So in reality, our attitude about something is way more important than actually what is happening. Our attitude about this pandemic and all the restrictions is way more important than this pandemic and all the restrictions. So I want to talk to you about some coping strategies, but I also attitudinally want to speak candidly with you, if you'll bear with me. And that is this. We need to be realistic about what's going on right now. We need to embrace the reality that this holiday weekend is simply, as we know it, not going to happen. But we need to remember why. We're in the peak of a global pandemic that threatens our health and threatens our life unless we are willing to take drastic measures to keep ourselves safe. So this weekend is not about my Easter picnic. It's about being safe, and it's about being here tomorrow. So I want you to stop telling yourself that this isn't fair. And I want you to stop telling yourself that you deserve better than this. Because even though you're right, it's not fair. You do deserve better than this. That doesn't matter. It's not going to happen anyway. Pandemics do not discriminate. It simply is the way it is. And we can embrace it with the determination to get through it well, or we can be downtrodden and angry and upset and anxious about it. So I want us to put this in perspective this holiday weekend. Just because this holiday is going to be stressful, it's not the new time. Holidays have always been stressful. This is just going to be stressful differently. Oftentimes our holidays are disappointing, and this is certainly disappointing. If you want to look on the bright side, now we have an excuse for why this weekend isn't going to measure up the way I hoped or the way I wanted to. You can't blame me for that anymore. I want you to think about having a sense of humor. You know, humor is the prelude to faith, and laughter is the beginning of prayer. So find things that make you laugh. Look for ways that this can be humorous to you. Like, for instance, what I've discovered this week is I no longer need a yardstick to measure 6 feet. I got that one down. We got it covered. Look for ways to be on the light side of this rather than on the heavy side of this. That's an attitudinal decision, not a reality decision. But then at the same time, acknowledge your emotions and your feelings. If you're sad, talk about that. If you're angry, write about that anger. These emotions are real. And embrace them, acknowledge them, give them some expression in a reasonable and controlled way so that they don't fester, so that they don't build up on you. Be honest with your feelings and emotions. Reach out to other people. Remember, we are social distancing. We are not social disconnecting. So reach out. We've got the technology to do that. Talk to people, speak to people, listen to people. Also this weekend, whoever you are with, set aside your differences. We're in close quarters right now, and this is not a time to bring up those old arguments. Declare a moratorium this weekend on those conflicts and those arguments. We can get to it next week. This is not the time to settle that score with your mother-in-law. Let's be peaceful this weekend. Don't abandon your healthy habits. Those things that we've been talking about, how to continue to eat well and eat good foods and hydrate, drink water, get plenty of sleep, exercise, get outside, breathe the fresh air, feel the sun, feel the rain if it's going to rain on you. But don't abandon those healthy habits because this weekend is disappointing or you feel trapped or burdened. Let's keep those going. And take breathers throughout the day. I recommend at least 2 or 3 times a day, take 15 minutes and step away from everything. Get alone, get quiet, and do some breathing and do some relaxing. You'll be amazed how well those brief breathers will help you sustain and help you be resilient through this time. And then finally, I want to remind you that this weekend it's a holiday weekend, and it's a religious holiday weekend. If you're a person of faith, be in prayer. What better time to have a religious holiday and to be in one right now that is here to celebrate resurrection? Because there will be a time where we resurrect from this. We will get on the other side of this. Remember that. Instead of looking at this weekend as what I can't do that I'm accustomed to doing, let's look at the true meaning of this holiday and the message that we all, as Americans and as Victorians and as regional people, are binding together, and we are being so helpful and so clever and so imaginative. Challenge your imagination. Look for ways to be more creative than you've ever been. The things that you can't do this weekend, figure out what clever and imaginative and brilliant things you can do instead. But get through it and enjoy yourself and enjoy the people you're with. Now, if you all have any questions, we'll take some questions at this time, and I'll be happy to dodge any questions you have.
I'll start with a question about resources. I am curious, in y'all's regard, how would you characterize, I guess, the volume of calls that you guys have been getting from community members who do need assistance in regards to mental health? And then, of course, in regards to this weekend, if someone's experiencing something where they do need assistance, where would you guide them or direct them to go?
If they need assistance this weekend or any time, we have some hotline numbers, and I think you have those. Maybe we can share those at some point. There's a couple of hotline numbers, well, actually three primary. One is a COVID-19 number, which is an information line. That's not to help you if you're feeling bad, but that's to give you information you need about what do I do now. There's also a mental health support line, which is for people who are stressed or nervous or overwhelmed and just need someone to talk to. So this weekend, give that a call. Then there's also a crisis hotline, which if someone is in mental health crisis. Now, in terms of added calls, our hotlines have been able to really accommodate the calls. They're steady, but it's not a large volume. And some of that may be that at Gulf Bend, we set up early and have been functioning for the last 2 or 3 weeks remotely through televideo, through telephone, through FaceTime. Our case managers are working every day, just not face-to-face.
Any other questions right now? Okay, I just wanted to thank everyone for tuning in today and give you the reminder that accurate information is very important right now. If it's released on our Victoria County Public Health Department Facebook page or on our website, victoriatxoem.org, it is accurate Victoria information coming directly from your local officials. And our COVID-19 hotline is another great source for information. That number is 361-580-5796. That hotline will be operational today until 5 p.m. and resume on Monday morning. Tonight, this will air on Suddenlink Channel 115 or 15 at 9 p.m. And Fox 19 will also replay this briefing at 10:35 p.m. Following the closing of this briefing, a recording will also be aired on Kix, Q92, Jack FM, and Club radio stations. For anyone with unmet needs at this time, please call 211. And the state mental health support line is open 24/7, and that number is 833-986-1919. I'll repeat that one more time. That's 833-986-1919. Our emergency management coordinator, Rick McBrayer, wanted me to remind the public that we do have an enhanced risk of severe weather this afternoon through this evening. So please stay tuned to your local radio and weather stations and take proper precautions. Again, as of 2:30 this afternoon, we did have 9 new cases, bringing our total case count to 70. These numbers may change before our 5 p.m. briefing today. With the upcoming holiday, we won't have press briefings Good Friday through Easter Sunday, and the hotline will be closed tomorrow as well, but opening again on Monday. And the city and county parks will be closed through the weekend. I just wanted to thank Victoria for your time tuning into this. It's been a pleasure to be able to talk with you and communicate and have wonderful people like Lane in to give us help to get through all of this together. And I wanted to thank everybody for the actions you guys are personally taking at home to slow the spread of COVID-19. I wish you all a very happy Easter weekend. I hope you enjoy it with your families, and we'll see you Monday at 3 p.m. Thank you.